availability. For bulk purchase, contact TACO office on 0244-871-862 and Okaishi Drug Lane, Accra office on 0244-683-583. Cancer mixture, a world devoid of sickness. So this morning we're going to have a conversation on cardiovascular diseases, CVD, and we hear that it is the leading cause of death worldwide. In studio we have Reverend Dr. Albert Agbi. He's physician specialist, cardiology, senior resident at the Kolebu Teaching Hospital, and he will tell us all we need to know about our hearts and if truly cardiovascular diseases are the leading causes of death right now. Good morning, Reverend Doctor.
Yeah.
How do people usually call you, Rev or Doc?
Albert is fine.
Albert is fine.
Yes,
All right, let's stick to Albert. Good morning, welcome to our show. How was your weekend?
Busy as usual.
Yeah?
Sure, very busy,
right.
but yeah,
Okay,
we are
right.
grateful.
Okay, so is it true that cardiovascular diseases are the leading causes of death right now?
Yes, it is. If you look at good morning, everyone, and thanks for the opportunity to be here. If you look at our biggest, in the past decade, and let's say even more than the past decade, we used to die more from communicable diseases. And what it means is diseases that can be transferred from one person to the other, like infections like HIV, tuberculosis. So there used to be a lot of campaign about those diseases. Okay. And then we have all these commissions that were responsible for giving free drugs, awareness and all that. Okay. Now we are dying more from lifestyle related diseases, and they are non-communicable. So example like hypertension, heart attacks and all that. Okay. So we are dying more from them. And if the last time I was here, we were talking about hypertension, and we said 3.5 or 35% of Ghanaian adult males, adults, both males and females, from 30 years and above. So it means out of every 3 to 4, out of every 10 Ghanaians you meet, 3 to 4 of them have hypertension and probably don't even know it because people don't check their blood pressures. So the percentages are on the rise. And if you look at complications of cardiovascular disease, it's not just the hypertension we are talking about. We are talking about stroke, kidney disease, heart attacks, and all that.
And so all of these are on the rise.
They are all on the rise. If you come to a stroke unit at Kolebu, it's full. You go to 37, it's full. You come to our emergency. I've worked at the Kolebu emergency. It's heart attacks, and they're on the rise. And then, so what's the age bracket now? Is it still the bracket above 50 or it's no, not at all. We are getting more people even in their 30s, 40s who are having these complications. So it used to be elderly people, but now the risk is coming, downward because we are not living healthy, more sedentary lifestyles, and we are not taking health as seriously as we should. Okay.
So, Doc, what should we do? How do we get our hearts to be healthy?
Okay, so two things. If you are going to look at risk factors for cardiovascular disease or what predisposes a person to it, then you have modifiable and non-modifiable. Okay. So modifiable means that you can do something about it. Non-modifiable means you can't do anything about it, but at least you can discover there is a problem. So general is non-modifiable. So age. Once you begin to grow, your risk increase. And generally, if you talk about males, our risk increases quite early. Females are protected until menopause. It doesn't mean they don't have complications before. They can. But generally there is a hormone or a chemical in a female which protects the female till menopause.
What hormone
estrogen.
Is that?
So once the estrogen levels go down, their risk skyrockets almost to the level of a male. But generally age, you can't do anything about growing up. So that's 1. 2, your sex. So that's what I spoke about. Males first, then females. Then 3, family history. So if you have a family history of hypertension, family history of people having strokes, heart attacks, and all that, then you are at a higher risk of developing than someone who doesn't. So you can't do anything about your family. Then the next one is your genetics. So people are born with certain predispositions or certain risk of developing certain conditions. They can't do anything about it. Then the modifiable one, that's where our conversation will be. High blood pressure, which we spoke about. So it means that you need to check your blood pressure. If from January till now, you've never checked, you are at risk. And even if you checked yesterday and it was normal, today it can rise and you may never know because it has no symptoms.
So on that note, you advise us to check our blood pressure constantly.
Yes, every home apart from a TV and all the things we have should be a blood pressure monitoring device.
It is a necessity now.
A necessity.
Okay.
Everybody can check. Okay. Then the second one is high cholesterol levels. If you don't check, you will not know. I had high cholesterol level at a point. I didn't even know. I mean, I didn't do anything awkward. I've just been eating, but of course, sedentary life and all that. So if you don't check, you won't know.
Doc, what's high cholesterol?
So what we call oil, okay. I mean, for lack of a better word, oil or high levels of oil in the blood.
Okay.
What it does is that it chokes the tubes that carry blood around the body. So if let's say you have a sink at home and you wash dirty dishes in, after a while you realize that water can't flow through the sink until you pour, let's say, hot water in. So you realize that the oils choke the pipes or the PVCs that carry water away, and it happens like that in our body. Everything we eat, carbohydrates, banku, kenke, is converted into a form of fat in the body as a storage form. That's how the body stores energy. So after a while, you realize that the levels can increase. So if you don't check, they block the tubes that carry blood around the body, and that's what causes strokes. That's what sometimes can cause kidney disease and many of the complications we see, heart attacks.
Okay. Does body size or weight have anything to do in this matter?
Yes and no. Because generally, if you are obese or overweight, your risk of cardiovascular disease is up. So it is much, much better to lose weight. But there are slim people who are also unhealthy. I mean, many of my patients who walk in, who look slim, and everybody who like the perfect body shape, your genetics can affect your lifestyle. Many of us live a very sedentary lifestyle. You go to the office very early, you sit down, you work through long working hours, and you go home. So once you are not active, there is a build-up. Energy is not being used and your risk can be high. So yes and no. It's generally recommended that you have a slim body type or you lose weight, but even when you've lost weight, you have to check certain parameters to be sure you are okay. So that would have brought me to obesity, which is modifiable. Then smoking increases your risk like none other. So it's generally recommended that people either stop or reduce the amount they are able to do. Then physical activity, then our diet, then alcohol. Then the last one I'll speak about is stress and poor sleep.
Please, let's emphasize on that.
Yes.
Especially for the working folks.
Yes.
Stress and poor sleep.
So take your leaves, and when I need this advice. I need this advice myself.
You yourself, man. You need to go leave, doc.
Yeah, I'm on leave, but if virtually you're on leave, but you are still doing a lot of things around. So generally, you need to be well rested, and you need to take it easy because your body malfunctions when it's not well rested. It doesn't function the way it was meant to.
Right, doc. So walk us through what a body would look like if you go for days on end with improper sleep or lack of sleep.
Okay, so generally, the body is like a working machine. Generally, you are working for more, and even if you are not running, as we are seated here, we are not doing anything. There are close to about 300 to 500 processes happening in only your liver.
As I'm sitting still right now.
There are different chemical reactions and things going on. So, whether you are, even when you are sleeping, there's a lot going on to keep you alive. Your heart is beating whilst you are sleeping. Your lungs are breathing whilst you are sleeping. Your gut is moving. There's a lot happening at every point in time. And when you add work to it, it increases the level of things that need to be done at every point in time.
Right.
So just as every machine, if you turn on the AC continuously for, let's say, a month, you realize it begins to malfunction. Things accumulate in, things get broken and all that. So it's same with the body in very simple terms. And that's why sleep and rest is very important when it comes to.
Right.
Yeah.
Doc, then how does heart disease go unnoticed?
Okay, many times it doesn't go unnoticed. It's because people don't pay attention. There are a few cases where it goes unnoticed. I'll give you an example. A 35-year-old walked into a room where I do scans of the heart. I do an echocardiogram for this patient. He was just doing a routine check. When I put the probe, or what we call the cardiac probe, to check the function of the heart was virtually beating at 25%. And he was okay. He was living his life. There was no problems. He was just doing a routine check. And I said, how did this happen? And he didn't know. So I had a flu. about 3 weeks ago. And there is a heart condition we call myocarditis, which is like a viral infection that attacks the heart. And that's how it happened. So he felt like it was malaria. I'm feeling tired and all that. He took some anti-malarials and he thought he was okay. So many times it doesn't go unnoticed. It's just that you may not be a professional enough to know what this means. Like this thing I'm feeling, what does it mean? Because sometimes it's not only the chest pains, it's not only the irregular heartbeats, which are the things that people will generally report. Sometimes just being tired, you walk a little, you get tired, you walk a little, you get tired, you are not able to breathe properly. So it manifests in different ways and forms. And that's why sometimes, even without symptoms, you need annual medical checks. It's not a routine for Ghanaians. Ghanaians want to get sick, then you have the motivation to come to the hospital.
Yes.
And the most dangerous of the people are those who don't get sick, because many things go unchecked, they go unnoticed, they develop over time, and by the time you are seeing the doctor, there are complications.
It's a bit late.
Yeah.
Okay, you mentioned the man whose heart was pumping at 25%.
Yeah.
What's the ideal percentage for your heart rate?
So generally we want it above 50%, right?
Okay.
But sometimes even above 50, someone's percentage can be less than 75, but the heart is not relaxing well to receive blood, so it's pumping well. The percentage I just called is the ability of the heart to pump, right? But it's not relaxing well to receive blood, so we call it heart failure with preserved ejection fraction. It means that the heart is still beating like this, but it is not relaxing well to receive blood. So the person will still get tired, will have signs and symptoms, and still have complications. Then the one which is below 50% is the one that the heart is not pumping well, so the symptoms, show themselves.
Okay. So at this point, when you discover that you have any form of heart disease across Ghana, is there enough help?
Generally, we have help. Generally, but of course not enough, because we have very few cardiologists, across the country. We look at certain regions, there are virtually no cardiologists working in some of our regions.
Why?
Accra,
can I ask why?
Because of the numbers. Even in Kolibu, in our teaching hospital, how many full-fledged cardiologists do we have working here, where it's like our biggest referral hospital? You go to 37, you go to our big hospitals in Accra, how many cardiologists do we have? It's a numbers game.
Okay.
So generally we have help. So don't also say that there are not enough, so you don't go. If you see a general doctor, they will see you, they are able to detect that there is a heart problem. Then they refer you. Even in the UK, everywhere in the world, there is a referral system to a cardiologist or a specialist who will now continue your care. So generally there is help, but it's nowhere near what it has to be, and that's why there is still efforts to train more people in order to train more doctors. Generally. Right.
So what would you say to someone who says that every time they walk, their heart sort of beats fast, but then they think it's because they have anemia, self-diagnosed?
Okay, so generally, if you are a woman, the risks increase because there is a thyroid disease that can affect the heart. That's one. Two, if you have any irregular beats, we have a simple tool called an ECG, which is no electricity company of Ghana. You just put some leads, some things on your chest and check how the heart is beating. Because this could be a heart failure presenting itself through a symptom. So don't diagnose yourself. Don't assume this is malaria. It is better to get checked and be normal than not get checked, because many times I even had someone coming in with headaches, and then based on further questioning, we realized that there's also something else. Then we checked, and then the heart had a problem. So it's almost always important to get seen by a health professional who is trained to pick up things. Sometimes someone just walking into my consulting room, I can tell the heart has a problem just by how their face looks, just by how they are breathing, just by what their rate is. So it's a lot more than what you are even seeing, but when you come in contact with a professional, they are able to fish it out.
Right. On an ending note and creating this awareness, what would you say is the biggest challenge to combating health disease in Ghana?
Number one, late presentation. Late presentation. People assume for long, and by the time they come, there are complications. Two, resources, both human resources and what to do, because there are many facilities that can do an echocardiogram, which is a scan of the heart. Even ECGs is sometimes a difficulty. So maybe because of time, I'll leave it at that.
No, one more. Yes. We need to find what the challenges are.
Yes. Also money.
And then,
because it's a money game. Whatever you do, it involves money. If you have heart failure, it's the medications. There are availability.
Are the medications for disease? Are they
available is people who can't afford.
It's not on the insurance.
Some are on insurance, but some of the real ones that would kick in to do are not yet on the insurance. Yeah.
Doc, we need to have you again, and let's talk numbers and let's talk how people can be healthy.
Yes.
Thank you so much for coming. We've been having a conversation on the risk and consequences of heart diseases and how they go unnoticed. The way to know is to get checked early. And having this conversation with us has been Reverend Dr. Albert Agbi, a physician specialist cardiology senior resident at the Kolebu Teaching Hospital, and it is a game of numbers. Thank you so much for coming, Doctor. This segment is brought to us by Kindness of Cancer Mixture, a solution for your arthritic pain. Discover Cancer Mixture, the breakthrough formula designed to support joint comfort and mobility. Cancer Mixture, a world devoid of sickness. We'll take a break. When we come back, there's some numbers